Have you ever thought about whether a penile tension ring, also called a constriction band or cock ring, might be right for you? I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to go over everything you need to know about penile tension rings, also known as constriction bands. These are actually well-designed devices created to support stronger erections and enhance sexual performance. In this video, I'll explain what they are, review 6 commonly used products, and discuss the science behind them, along with the advantages and drawbacks based on both research and real-life experiences. Before we dive into specific products, let's cover a few important basics. Erectile dysfunction affects millions of men around the world. While medications can be very effective, many people prefer not to rely on them. That's where constriction bands can be helpful. They work by limiting the amount of blood that leaves the penis, which helps maintain an erection. As I've explained in some of my earlier videos, an erection happens when blood flows into the penis and stays there. When the erection fades, that blood drains out through the veins and returns to the body. These rings help slow that process down. In simple terms, they apply gentle pressure at the base of the penis, reducing blood outflow and helping you keep an erection longer. This can also lead to a firmer and fuller erection during use. When we talk about erectile dysfunction, there are 2 main types related to blood flow. One is arterial insufficiency, which is quite common and often linked to conditions like high blood pressure, diabetes, or high cholesterol. The other is venous leak, where the veins don't function properly, sometimes due to damage or other health issues. In many cases, men experience a combination of both. These bands are especially helpful for men dealing with venous leak. However, even men without erectile dysfunction may benefit from them, whether it's to reduce performance anxiety or simply to experience a stronger, more reliable erection. Now, there are many different types of constriction bands available today. My general advice is to choose one that is specifically designed for penile use. Materials like medical-grade silicone are ideal because they're less likely to cause irritation and are easy to remove. It's very important not to use household items, such as metal rings, for this purpose. I still remember a case from my training that left a lasting impression on me. Actually, there are 2 cases, but let me share the first one. I remember one case where a man came in with an object stuck on his penis. It looked like a heavy construction nut, thick, solid, and not meant for the body. He had placed it there, and soon after, the rest of his penis became severely swollen. This is exactly what happens when something is left on the penis and can't be removed. The swelling makes it nearly impossible to take off. He had to come in for emergency help, and we actually had to call the fire department to bring specialized tools, including a saw, to remove it. It was a very distressing experience for him. Situations like this really highlight how important it is to only use devices specifically made for the penis. In another case, someone cut a plastic soda bottle and used the ring from it. The same thing happened: significant swelling, followed by a trip to the emergency room to have it removed. So please, I truly care about your safety. I don't want to see anyone end up in the ER going through something like this. It's not only uncomfortable, it can also cause serious injury. Often people delay getting help, sometimes for hours or even an entire day, and by then, real tissue damage can occur. Now, coming back to constriction bands, they can be used in several different situations. For example, if you're unable to get an erection at all, you can use a penis pump or a vacuum erection device, as we've discussed before, to create one. Then, you place the constriction band at the base to help maintain that erection. I've covered vacuum erection devices in another video, so be sure to check that out if you want to explore your options further. If you're able to get a partial erection through medication or stimulation, a constriction band can help strengthen it and bring it to a fuller erection. It's a simple and affordable way to improve performance. Even if you're already getting full erections, you can still use certain types of bands that include added features, like vibration, to enhance pleasure and sensitivity. These aren't medical-grade devices, more like recreational products, but they can still add to the experience. So, what are the main pros and cons? On the plus side, these devices are non-invasive, drug-free, and generally affordable. They can help improve the firmness and duration of erections, and for some people, they may also enhance sensation during intimacy. There are even newer models that can track aspects of erectile health, such as firmness levels. They can be used alone or with a partner, and some are designed to be worn even before a full erection develops. Now, let's talk about the downsides. These devices don't work for everyone. In some cases, they need to be quite tight to be effective, which can lead to discomfort, pain, or even numbness. Finding the right fit is also important. If the ring isn't adjustable and comes in fixed sizes, you may need to try a few to see what works best for you. They can also interrupt spontaneity, and because of the tight pressure, you might notice that ejaculation doesn't come out as usual. This isn't harmful, but if you're trying to conceive, or if that concerns you, it can be a drawback. Finally, if you accidentally fall asleep while wearing one, or use it while not fully aware and forget to remove it, it can lead to serious injury. The key thing to remember is timing. You should never wear a constriction band for more than 30 minutes. There are a few products designed for longer use, but those will clearly state that on their labels. Leaving one on too long can cause pain, bruising, nerve issues, or even tissue damage. Also, if you have certain medical conditions, especially those that affect sensation, you might not realize it's still on. If you have a history of blood clotting problems, have experienced priapism, an erection lasting more than 4 hours, or are taking blood thinners, this option may not be suitable for you. It's always best to speak with your urologist beforehand. When using these devices, it's a good idea to apply lubricant. It helps with comfort and makes the ring easier to use without reducing effectiveness. Now, let's go over the different types available. The first kind you'll often see is the O-ring. These are simple in design, usually affordable, and generally effective. They're a good choice for men with mild erectile dysfunction, or for those looking to enhance sensation. Sometimes they can be a bit tricky to put on or take off, but lubricant can make that much easier. Let's look at the first example. One type of O-ring is the Osborne VenoSeal. The Osborne VenoSeal is an adjustable constriction loop, sometimes called an O-loop. It's placed at the base of the penis, where it applies gentle pressure to reduce blood flow leaving the area, helping maintain the erection. These are usually adjustable, which makes it easier to find the right fit and level of tightness. That said, it may take a bit of trial and error. You might begin with a looser setting, and then realize you need to tighten it slightly for better results. Since these are made from silicone, it's important to avoid silicone-based lubricants, as they can break down the material over time. Instead, stick with water-based lubricants. Just keep in mind that water-based options can dry out, so if you start to feel discomfort after 5 or 10 minutes, you may simply need to reapply. Many people find these rings both effective and comfortable, though some feel they can be a bit awkward to use. Others mention that they can shift or loosen when lubricant is applied. At the moment, these typically cost between $24 and $30, depending on where you purchase them. There are also more advanced options beyond these basic designs. The next one is known as the FirmTech Performance Ring. This model is made from a soft, medical-grade elastomer, which helps reduce the pinching sensation some users report. It features a simple hook and loop closure, making it very easy to put on and remove. You place it at the base of the penis and adjust it until it feels comfortable. This design applies pressure not only at the base of the penis, but also around the testicles, as it includes 2 loops, one for the penis and one for the testicles, helping maintain blood flow by limiting outflow. One of the standout features is that hook and loop closure, which makes it very user-friendly. The most common complaint is that adjusting it precisely can sometimes be a bit tricky because of that closure system. Still, it's very soft and comfortable, which is why many users like it. Another option designed with added comfort in mind is the Eddy by Giddy. This ring has a grooved design with a specific space for the urethra, which can make it more comfortable since that's often where people feel pressure or pinching. It's an FDA Class II registered medical device and features a unique horseshoe shape that helps avoid compressing the urethra. It comes in 4 different sizes, and you can determine your fit with their sizing system. If needed, the company even offers free resizing. The ring also includes ridges, which can enhance sensation for both you and your partner. To use this device, you place it around the base of the penis and then choose a specific tension band. You can select either a tighter band or a looser one, depending on how much pressure you want. It does require a bit more coordination than a basic ring, since you need to hold the device steady while attaching the band. It's made from silicone and is generally comfortable to wear. Some users mention there's a bit of a learning curve at first, but overall, it's considered a solid option. If you happen to choose the wrong size, the company will send you a replacement at no extra cost. Another unique option is the Ziala constriction ring. This one is also backed by clinical research and is designed to help with venous leak. One of its standout features is a non-slip design that keeps it securely in place during use. It includes a band that connects to an adhesive pad positioned behind the penis. You place the ring at the base, pull the band back, and attach it to the adhesive pad. One added benefit is that some users notice a slight increase in apparent length due to that backward tension. Overall, reviews for this product are quite positive. However, some people do experience mild skin irritation from the adhesive pad. In those cases, using a protective spray on the skin beforehand may help reduce irritation. Next, let's talk about vibrating penis rings. An example is the Lovence Dynamo vibrating ring. This type of device adds vibration for extra stimulation and is often used by individuals or couples looking to enhance pleasure. These rings typically come with adjustable intensity levels, different vibration patterns, and rechargeable batteries. This particular model is app-controlled, allowing you to manage the settings from your smartphone, even from a distance. It's designed more for enjoyment than for treating erectile dysfunction, though it may still help support erections and improve stamina. You simply place the ring at the base of the penis, and the vibrating component provides added stimulation, which can be controlled through the app. The silicone material is usually comfortable, but for those with a larger girth, it may feel a bit tight. There are also different ways to wear and use these devices depending on personal preference. So, that covers everything you should know before choosing a constriction band, along with the different types available today. Keep in mind, what works well for one person may not be the best fit for someone else. It's a good idea to read reviews, try what feels right for you, and consult your doctor if they have experience in this area. They can often recommend options that other patients have found helpful. If you're enjoying this kind of content, don't forget to subscribe. And as always, remember to take care of yourself, because you truly deserve it.